Um, Good afternoon, team. Can somebody confirm if you can hear me? Lydia, confirm if you can hear me.
We can hear you loud and clear.
Oh, thank you. Thank you, Moses. Yeah, good afternoon, team. Kindly let's mobilize our other colleagues to join, because I can see the numbers are still, we're still quite few in the call. We can purpose to begin at 10 past 2, so that we give some bit of time to our other colleagues to join. So meanwhile, let's mobilize. Thank you. Let's begin at 10 past 2. Thank you. Yes. Good afternoon once more. So let me take this opportunity to welcome all of us into our second series, this part of our virtual training. My name is Franklin Songok. I work at NASCOP SI. I want to request a volunteer to lead us in a word of prayer before we begin. I know I'd said we'll begin at 10 past 2, so we can take a minute to pray, then we begin. Moses, now that you have the mic, you can lead us in a word of prayer.
All right, Songoka, let us believe and pray. Father, in the mighty name of Jesus Christ, we thank you for this wonderful opportunity again that you've granted us, just to meet below this big tree of knowledge, so that we can be able to sharpen our access, Lord, so that this particular product that you have given unto us. Pray that you may open our inner ears so that you may be able to get all that is going to be imparted onto us, that you may also guide the presenters of the day. I pray this short prayer, trusting and believing in your Son, Jesus' name. Amen.
Amen. Thank you, Moses, for leading us in a word of prayer. So once again, let me take this opportunity to welcome all of us into our virtual training. Today we'll be focusing on billing and the bill processing. And some of the areas that the team will cover today is just take us through how to set up the billable services. Of course, just looking at the items in terms of the products, and of course the services that require billing to basically enable the receivers of services to make the payments. We will also be able to take you through the billing workflow and how to create the bill, and finally how to just go through the whole process up to the end in terms of ensuring that the bills are settled. So our agenda is basically that, and we will begin by just going through an introduction to the billing module, which we will be taken through by Bernard Otieno from Palladium. And then Mary Ann will take us through the navigation of the module within KenyaEMR. So I'll request that we make use of the chat in case you have any questions. As we are taking through the navigation, if you have any questions, kindly let's utilize the chat. There's a team that is available to respond to any of the questions that you have. This series were organized based on the feedback that we received from your end. Someone's mic is on. Someone's mic is on. Moses, I don't know. You can help me mute. I don't know whose mic is on, but there's someone's mic which is on. Yeah. So I was just giving a preamble of the genesis of us planning or organizing to have this series. I think based on the feedback that we received from your end, it was noted that we still have a capacity gap in terms of how the users are enabled to competently navigate some of these modules. And I think the modules that were given priority is the stock management module and the billing module. So last week, we were on Friday, we were able to take you through the stock management module. So today, like I've already said, we're going to cover the billing module, and of course, we will be able to plan for more in the coming year. So at this point, I really don't want to take much of the time. I want to welcome Bernard Otieno to introduce himself and take us through the first part of the presentation. Once he's done, I would request that you welcome Mary Ann to take us through the navigation bit. Then after that, we will pause for our Q&A, and of course, as she is doing the navigation, I would encourage all of us to utilize the chat just in case you have any bits that you want clarifications on. So we have a team that will respond to any of your questions. Of course, if you have a question that you feel that you need to verbalize, we'll also give you an opportunity to ask your questions before we close our virtual training. So at this point, allow me to welcome Otieno. Meanwhile, let's also introduce ourselves through the chat. We may not really allow everyone to introduce himself or herself because of time. So let's utilize the chat for that. But I'm sure also before you join the call, you are required to do the registration. So basically, I think we'll be able to pull all that from the link. Otieno, over to you.
Thank you very much, Songok. Confirm if I'm audible to your side.
Yes, I can hear you loud and clear. Proceed.
Yeah, thank you very much. I think you already introduced me. My name is Bernard Otieno. I work with Palladium, supporting capacity building. So just like Sungoka alluded, today our focus will be on the billing module in the facility-wide KenyaEMR. So just for introduction, I would like to share my screen. So I don't know if you are able to see the screen.
Yes, I can see your screen, Atieno.
Yeah, thanks. Yeah, so we'll be focusing our attention today on the billing module. So this is in reference to the facility-wide KenyaEMR. One of the key modules that exist in the facility-wide KenyaEMR is the billing module. So last week we were able to take you through the stock management module, and these online virtual trainings are actually being selected based on the feedback and also the identified gaps among the facilities that are already utilizing these modules. So we felt that it was good for us to focus on the two before the close of the year. Yeah, so that as we go over the holidays, users will be comfortable navigating these particular modules. So I'll just go through the introductory session on the billing module in KenyaEMR, highlighting some of the key features and the value proposition for the module. And I'll give way to my colleague, Marianne, to take you through the navigation so that you know how to navigate, how to create the bill, how the bill is processed all the way. So the entire cascade, so that you understand how that particular model is supposed to actually work. Yeah, so as I've already mentioned, billing module is a key component of the facility-wide EMR because for facilities that are charging, they would need a way to create and process the bills, and also to track their revenue. At the end of the day, they would want to know how much has been collected. At the end of the day, there are some processes in terms of waiving that they want to undertake. So all those procedures, as regards the billing, we'd like to take you through, and all that is included in that particular module. Yeah, so the primary purpose for the billing module is just to streamline the financial operations within the facility by reducing a lot of administrative tasks that are involved in the bill management and revenue management of the facility, and also to ensure that fiscal errors are minimized to the bare minimum, so that the fiscal report for the facility should be reflecting as accurately as possible at the end of the day. And this can only be done if we ensure that everything is done through through KenyaEMR. All the bills are treated through the KenyaEMR. Services rendered are documented within the system, and that way it makes it possible to now generate accurate fiscal reports for the facility at the end of our working day. Yeah, so the key module functions, as you realize, if you are new to this, one of the key functions is that the module supports automated bill creation. For instance, it may be a patient is seeking a particular service. The provider will be able to just specify that service, and the system will automatically post a bill based on the same, and that will be payable at the cash office. Yeah, that will be payable at the cash office, and that is how the system helps in managing that. And at the end of the day, the cashier is able to print the invoice. They're able to generate a receipt after the payment, and this can be printed through any printer, including the thermal printers at the facility. And also the other key function is the payment processing and the tracking using multiple payment options. Right now, mobile payment is supported through M-Pesa, and the good thing about it is that it also has the SDK push, where the patient just says his or her phone number, and then the system does the SDK push to their phone so that they are prompted to only put in their PIN, and that works seamlessly and it is very fast. There are other payment options like insurance and cash, but I think from the facilities that we've heard from, they rarely use cash, but some of them use insurance like SHA. In other instances, there are bill waiving processes that system also allows where you're able to waive some of the bills, depending on how the facility processes on waiver takes place. And that also includes the e-claims. For the e-claims, it might not appear in your current version, but in the next version, you'll be able to conduct the e-claims for different insurances that facilities support. Again, also the support for configurable billable services and commodities at the facility. So the system allows you to modify your billables. That includes the charges for the drugs, the charges for the non-pharmaceuticals and commodities. All that can be configured within the system so that as the facility or as these services are rendered to the patient, the system is able to generate the bill based on the amount that is configured in the chargeable items. And at the end of the day, the facility is able to benefit from the reports, the revenue reports, both within the EMR and also within the dashboards that are at the facility level and also at the above site, which means that even at the county level, the county is able to look at the dashboards generated and see the performance of revenue within that particular county. Yeah, so some of the key features here includes the patient registration and billing, which links the patient registration data with the billing information, and also the automated capture of charges based on the services that the patient need or that are rendered to the patient, and that includes services and also commodities. I've talked about the availability of multiple payment methods as part of the payment processing, which includes mobile money, insurance, and cash. And this is reconciliated to patient's account so that at the end of the day, you can go to a specific patient and also generate their payment history in terms of what have they been able to pay within this particular encounter or within previous encounters at this particular facility. There are a lot of reports on analytics on the revenue side, which includes the dashboard that I've already talked about, and also the possibility of waivers, and also the e-claims, which supports also different insurances and also the social health insurance fund. So what are the benefits of this module, especially at the facility level? One is the improved efficiency, because it kind of removes the manual process of doing things, and also ensures that there is faster processing of patient bills and with instant printing of the receipt. Again, there is enhanced accuracy with very minimal errors because there is no human intervention in terms of posting the charges. If the charges are already pre-configured within the system, there's no human intervention. So that means that accurate bill will be generated for the services that are being rendered or for the commodities that are being consumed. And that leads to better financial management for the facility in terms of looking at their reports, looking at their level of revenue collection, and that means that with those reports and the dashboards, the facility can make better decisions in their fiscal management and administration at the facility, and also the fact that there's transparency in the processing of bills creates a lot of trust within the facility, between the facility and the patient, because everything every patient gets charged same amount for the same set of services rendered. Okay. So from the point of implementation, there have been a bit of challenges, and again that we also acknowledge based on different facility levels. So there are facilities that are charging just small component. There are facilities that are charging everything. So depending on the facility level. So one, you find that there's a lot of customization requirements that are expected so that it fits a certain facility context. And that has been a bit challenging because you have to have a lot of back and forth to ensure that it fits the use cases of a particular facility. Again, also where there are requirements to integrate with existing financial systems or revenue management systems, there have been a lot of delays in terms of having those back and forth to ensure that the system can work with other systems as well. So that integration kind of creates delays in implementation. And again, one challenge which we are addressing with this training is the user capacity gaps, where sometimes it is apparent that some of the issues that are being reported by users are purely capacity related, and some of them are just navigational issues, where if we build your capacity, we train you, and you are able to follow through this training, you'll be able to adequately utilize this module most effectively at the facility. Yeah, so that is the bit of the overview. So at this point, I want to just usher in my colleague, Marianne, to now take us through the actual cascade of how the bills are created within the system, how we develop, how we configure the billable items, all the way to how we are able to now see the financial reports at the end of the day. So over to you, Marianne. Please take the mic. Thank you. Marianne?
Is Marianne in the call? Otieno? Yeah, I can see she's in the call. Marianne, confirm if you can hear us. Otieno, can you hear me?
Yeah, I can hear you. I think Marianne is muted.
She had unmuted. Marianne, if you're speaking, we can't hear you. Her mic is on at the moment. Marianne, you probably may need to exit the meeting, then rejoin, because we can't hear you if you're speaking. Habari yako? Nzuri. Oh. Marianne, we can't hear you still. Or Roshena, can you hear Marianne? Probably it could be network on my end.
I confirm now that I am audible from your end.
Yes, I can hear you now, Marianne. Go ahead.
Okay, all right. Sorry for that. I think my connection wasn't okay. So allow me to share my screen so that I can take you on a journey of the billing module in KenyaEMR. My name is Marianne Mwangi. I work with Palladium Kenya. Please confirm my screen is visible from your end so that you can proceed.
Yes, it is. Proceed.
All right. So allow me to log in with one user account so that we can be able to go through the different functionalities for the billing module. So I will start with some administrative functions, which we need to start from the system administrator, assigning specific users, specific roles for different cadres so that they can be able to perform some functionalities within the system. And we will concentrate with two key users, one being the finance manager or the billing supervisor or the hospital admin, who has various responsibilities in the system. And the second one will be now the cashier or the billing personnel. And be looking at the specific roles and responsibility for these two users as we navigate through the system so that we can be able to understand what specific roles they are tasked with. So I will want us to start from a point where the system administrator has been able to assign two user roles. One is a finance manager role, and the second one is a cashier. So starting with the finance manager, this is the person who can be able to access the billing module, who can be able to set up billable charge items or what a particular client should be charged for, who can be able to process waivers and bill refunds, who can be able to cancel a bill, who can edit a bill, and at the same time, they can also be able to delete a bill, and they can configure payment points, they can process exemptions, and they can also be able to assign cashiers to the specific cash points. So for the role of a finance manager who will help us with the billing administrative functions, one of the things that they will be able to do is to access the billing module. From the billing module, they'll be able to specify what are the specific payment points in a particular facility. And this is especially for high volume sites where you may have different payment points. So from the billing module, we will access the payment points, submodule or subsection. And from here, you can be able to establish for a particular facility, what are the specific payment points? What do we mean by this? We can have a payment point, for example, at the registration desk when a patient comes into the facility. We can have another payment point at the OPD, billing for consultation services and the like. We can have a payment point at the lab, at the pharmacy, at the inpatient. So how are we able to create the specific payment points? So from my screen, from the payment points window, we can be able to create payment points from this link here. And the system will ask you for the particular name for a particular payment point. For example, we can create a lab cash point. And the description for this one is for billing for lab orders at the laboratory. And you can be able to create. And once you create now, you'll be able to see that we have a specific cash point labeled lab cash point. a bit of the description, and specific actions that we can be able to do. So we can still be able to create another one, maybe for pharmacy. Again, this is billing for pharmacy orders or for drug orders. And you'll be able to see all the specific payment points depending on how a particular finance manager or system of hospital admin is able to create depending on the particular system. So for example, if we take one of these particular payment points and we view, we can view like the pharmacy cash point. Over time, we'll be able to tell any payments that have been made to this particular cash point. We'll be able to view the line list of the payments from the various patients, starting with the specific date and time, the patient name, their identifier, the amount they have paid for, and whatever specific service was actually billed at this particular cash point. Reference code, if this particular amount was paid using mobile money, and the particular status for that particular bill that was paid through this cash point. And at the end of the day, whoever is the cashier or the person who is manning this particular cash point, they can be able to download a report or the same line list for further analysis. Same case for the other cash points that we have created. We'll be able to view particular patients who have been billed from these particular cash points and so on. So the other things our particular finance manager needs to establish, apart from now the different paying points or different cash points in a facility, what are the particular payment modes that a particular facility accepts? And we can be able to do that from the payment modes submodule. And we select that. From this particular test instance, we only have one payment mode, which is cash, where particular clients can be able to make cash payments. And if we use other payment modes in a particular facility, we can be able to add them. So this link will help us to be able to add other payment modes. When I select add payment mode, we'll be able to set the payment mode name. For example, we can say insurance. Some of our patients may be using insurance to settle bills. And the description is insurance schemes, various insurance schemes, and we can be able to save and close that particular payment mode. At the same time, we may have our facility also uses mobile money. And this is using either M-Pesa transactions. We can save and close. We can add several payment methods. We can also have donations in a particular facility. And we can say in organizations, maybe making payments on behalf of some of our clients in our facility. And we can also add another one. For example, we can set waivers or exemptions depending on the particular payment modes that we have. Then over time, we will be able to either edit or delete a particular payment mode if we are no longer using it. For example, we can edit cash. If we are no longer using this particular payment point or payment mode, we can be able to retire it. Or even with time, we can be able to add different attributes to this particular payment method. And again, we can be able to remove or delete, turn it on and off, depending on whether it is being used in a particular facility. And again, if totally we are not using it, we can still be able to delete it. For example, if I try to delete cash payment, That means I'll only be left with 3 payment modes within this particular setup, where we now have mobile money, insurance, and donations. And this does not mean that with time, you will still not be able to add that particular payment mode. So again, I can just return cash for cash payments, and we save and close. So our finance administrator has been able to do 2 things. One is to establish the different payment points from where particular users will be able to make payments, and as well also establish the different cash payments, the different payment modes that we are using in our facility. Our clients can be able to pay for services, for services rendered, for items and commodities given out using cash, either via donations or via insurance or via mobile money. And with the time, again, if we view a particular cash point, sorry for that. So these are the key functionalities for our finance manager. The other functionality is that we have established the payment points in a particular facility. We have established how our users or clients are going to pay for services rendered. But now we need also to ensure that we establish for the items that in our facility we will need to charge for our patients. We need to define what are our chargeable items in terms of commodities, pharmaceuticals and non-pharmaceuticals, and even for the services. So to set that up, we will use the charge items submodule. So when we come to the charge item submodule, one, we will be able to establish different charge items that we can be able to put a price for within the facility. And again, it depends on now how users will pay. So that means we need to establish how much is a particular service or commodity billed for cash payers, for insurance payers, and for mobile money. For most facilities, you may find that for particular chargeable items, the price may be the same across the different payment modes that we have established. So before we even add a charge items, for facilities that have already started using this, it is advisable to just search so that, again, we do not cause duplications. So for example, maybe I want to add a price for a particular drug, such as losartan, and we find that it has not yet been added as a chargeable item. Then I'll try for another drug like amoxicillin. You may find again it has not been added as a chargeable item. But if I were to search for a drug like this one, metronidazole tablet 400 milligrams, you see it already even has a price attached to it. For example, it has a price for cash for 200. And the status is that it has been enabled. So that means if we were to give this particular drug to a client or a patient, they will be expected to pay a particular price that can be charged for this particular drug. Over time, for the charge items that we have established, we will be able to edit so that we can be able to modify either for the different payment modes or to even add. For example, this particular drug can only be charged for cash at 200, but we can also add other payment modes. For example, we can add mobile money, still charge the same drug 200 for mobile money, add maybe for insurance as well, again 200, add another payment method. The last payment method that we have, donations. Again, if somebody was to give a donation for a client who has been given this drug, they will need to pay 200, and we can save and close. So you see what happens now. Initially, we only had cash for 200, but we've been able to add over time the other payment methods. As well, if over time we are not charging for this particular drug or the drug is not available, we can be able to turn off the status. So when we turn off the status, it means when a clinician orders for this particular drug, it will not be billed as a chargeable item, and no amount will be affected for a particular patient, either because the particular tablet or drug is out of stock, or we are no longer either issuing this particular tablet in a particular facility. So when we say we turn it off and we save and close, it means that particular chargeable item is no longer active. If we try to dispense for this particular drug, the patient will not be billed any of the amount for this particular drug. Again, if we need to turn it on after some time, we can always be able to turn it on and save. If the price changes, for example, for the same drug, when we are no longer charging it at 200 for the 400 milligram tablet and we are charging at 20 bob, we can be able to still edit the price for the different payment methods or modes that we have created, and you can still be able to save and close. And you will notice again now the price will change. So that means when we dispense this particular tablet to a client, they will no longer be charged 200, they will now be charged 20 shillings per tablet. So for the chargeable items that have not already been set in the system, we can be able to do that under the actions button area, where we are able to either add a chargeable service, or we're also able to add a charge item. For example, we can start with a chargeable service. And a chargeable service is, for example, consultation, a particular service like an X-ray, a test that a patient can be performed for, and we can be able to add a few. So the guidance here is that we'll need to add the specific service name, give it a short name. If it is quite long, we can be able to use initials, or we can use the same name if it is a short name. But now we need to find the exact service concept that is embedded in the system that matches with that particular service. So it's always advisable, whenever you are adding a charge item, to search first using the service concept to confirm whether this particular service name that we are trying to add for already has an underlying concept in the system, which is a requirement. Otherwise, you will not be able to add the service name or the charge item, and you will not be able to use it even when trying to bill for a patient. So for example, we can have several services. For example, our patient may be due or have been ordered for a malaria test by our clinician, and we want to search for the particular malaria test. For example, it can be a rapid malaria test. Just add the word rapid. The concept already exists. Now, depending on how we at the facility define this particular tests is how we are going to put it as the service name. So for example, this is for rapid malaria test. That is how the test is called in our facility. Again, we can have a short name for it, or we can have, abbreviations. We can call it RMT. Then the service type for this one, this is a test, so it will be lying under the lab services. And we can now add particular payment methods for this, how we are going to charge for this particular malaria test. So for example, our patients will be able to pay using cash. Again, this test, we will charge 500 for it. They will also be able to make payments for the same test using insurance. But for insurance, the charges may be higher. So we're going to charge 1,200 for insurance for the same test. We can add another payment methods, mobile money. And we can also charge 500 for the same tests, and we can save and close. So when we do that, among the list where we had our chargeable items, we'll be able to see that now we have the malaria test, rapid malaria test. It is an enabled chargeable item that is offered as a lab service, and we can be able to see the different payment modes that we have set for it. Meaning a patient coming for this test who is paying for cash will be charged 500, insurance 1,200, and mobile money 500. And we can add a few more. Let me add one more. For example, maybe this particular service you want this time is an X-ray. Sorry, I'm searching in the wrong place. Should be the concept. So the system will list for you all probable service concepts according to what you're searching for, and it will be easier now for you to define exactly what we want. So we can say maybe our patient is coming for an X-ray of the leg. Then we can go ahead. We can go ahead to define the service name. So we can call it leg X-ray. We can use the same name for short name. And then the service type for this particular service is going to fall under the radiology department because it is an imaging service. And the same now, we can still be able to define the payment methods. For example, if somebody was to pay via insurance, again, how much will we charge for the X-ray? Maybe it's charged at 2,500. We can add another payment method, cash. Maybe for this particular service, we are charging the same amount. It is constant across all the payment methods. And we can have mobile money the same at 2,500. And we can save and close. Before you save and close, ensure that the status has been turned on so that it can be able to, whenever an order for an X-ray of the leg is created, it will be able to automatically create a bill of 2,500 in the system. So this particular status turning on and off is quite important. The moment it is off, it means for this particular service, even if a clinician orders for an X-ray of the leg, the system will not be able to automatically create a bill. So ensure that the status is always on, and we can always come and edit if we are no longer offering that particular service or there's something that is wrong with our imaging machines at the radiology department. Then let us add one more. Add one more service, and we can call our service consultation. And here again, we can be able to select the different consultation services that have been set in the system. And we can pick any, for example, clinical consultation. So our service name here, how we would want to define it is outpatient consultation. Short name for this, we can call it OPD consultation. Again, this will fall under clinical consultation as a service type. So it is always encouraged that you try to match the particular service name with the concept, the specific or the exact service concept with the particular service type that it falls under. Again, we can define the payment methods. We can start with cash. So for consultation in a particular facility or this one, we may be charging 150 for consultation across all the payment modes. I'll only add 3 or just 2. So 150 again. We can add one for insurance. Charging at 150 still. We can save and close, having confirmed that. the status for this particular chargeable item is turned on. So the reason I've spent so much time here is because this is one of the things that most facilities are struggling with, to be able to define what items are we supposed to bill for a patient and how do we add them into the system. So as a recap or a summary for this section, we can be able to, one, establish whether a charge item exists from searching whether it already exists. If it exists, something has changed with that particular charge item, we can always be able to edit the charge item and edit it according to what changes have happened. Two, if it does not exist, we can be able to add it. And adding a particular charge items is in two ways. One, for a service, and two, for a charge item that is either a commodity, especially for a pharmaceutical commodity or a non-pharmaceutical commodity. So for this particular instance, we've been able to add three things. We've been able to add for rapid malaria, an X-ray, an outpatient, and we can add for one more so that we recap on the commodity section. We can try and add for a drug. Let me see, we have losartan. Again, for cash, we can say we are charging 2 shillings for this particular tablet. Insurance, 2 shillings. Mobile money, again, 2 shillings. The reason I've added this one is so that we can distinguish between adding a charge item as a commodity and adding a charge item as a service. So as a commodity, we do not need to connect the charge item with a particular service concept or concept ID, because this has already been automatically done in the system. Remember, we get these charge items for commodities from an already predefined list that we normally import from the stock module. So everything has already been attached to this one. But when it comes to now the services, adding for a particular service as a charge item, that's where we need to correctly attach this particular service concept, give it a name, and also attach to the particular service type. So kindly note that there's a difference when you're adding a charge item as a service or as a commodity. And a commodity is a pharmaceutical or non-pharmaceutical product. So that concludes now the particular administrative functions for a particular user who is a finance manager, an administrative personnel, either a hospital admin or a supervisor within the billing staff in a particular facility. So having done all this, establishing the payment points, how our patients will pay and the particular items they will pay for and at how much, now we can be able to bill our particular patient. So again, the steps for billing are done by a particular user in the system, and we are going to assume now the role of a cashier for us to be able to do this. But remember, even before patients are billed to the cashier, another user in the system has to, one, search for a particular user and start a visit within the system, and maybe even queue them for the billing service. So we are going to start there, so that assuming the role of a registration clerk, I will look for a particular patient in the system who have already been registered. They have come for particular services, and we want to start offering them services. So I'm going to search randomly for a test patient in the system. So I'm going to take Paul Sharon Walker as my patient who has come into the facility at the registration desk. We've been able to search for them, and the system has redirected us to their patient homepage. So from the patient homepage, the work of the registration clerk is to confirm the patient and check in the patient or edit the registration form if anything has changed. So for the purposes of this particular training, we are going to check in our patient. So at the check-in place, this is where we establish, one, what the patient has come for. Maybe they have come for outpatient services. And two, at this particular point is where we establish whether our patient is going to be making payments for any services or commodities offered in this particular facility. So with the billing section here, is the patient exempted from payment? If the patient is exempted from payment, then we can say yes, and we can now select the exact exemption category. So that means anybody who is exempted from payment, a bill will not be raised in the system for the services that they will be offered, but at the end of the day, we'll be able to know how much was actually exempted from this particular patient in regards to the services they were offered. But if a patient is not exempted from payment, we will select no, and now the system will allow us to define what particular payment method is our patient making. So this is at the point where you're asking the patient, utalipa aje for the services that we're going to offer you. How are you going to make payments? So if the patient says, for example, they're going to use insurance, they can either use insurance, donations, or mobile money. If the patient says they're going to use insurance, then the system goes a step further to request for the insurance scheme, what particular insurance they are going to use. For this case instance, allow me to use mobile money. Then we can define, even at the starting point, are there particular services that our patient needs to pay for before they can access maybe clinical consultation or the particular thing that had brought them to come for in outpatient services. So for this particular point, maybe our hospital charges for OPD consultation or for consultation services. So you can select outpatient consultation, and we will be able now to queue our patient to the next service and check them in. So when we check them in, the system will alert you that they have successfully started a visit for that patient. 2, they have been able to create a bill for the first service that is chargeable for our patient, which is outpatient fee, outpatient consultation fee. And at the same time, if we had queued our patient for clinical consultation, it will also be able to alert you that our patient has been queued successfully. So that means now we can be able to tell our client, Paul Sharon Walker, to go to the billing window so that now they can be billed for clinical consultation charges that we had set at 150. So when this happens, that means our patient has been transitioned to the billing section. And assuming now the role of a billing cashier at the hospital, our billing cashier now will be able to process the payments from the billing overview. So that means they will be able to access the billing module. And from the billing module, they can be able to do specific things. 1 is to process payment. 2 is to process e-claims when we get to integrate with the shift scheme. And they can also be able to do several things that we're going to try and see. While processing the payment, they can be able to initiate an SDK push if that particular facility has already been integrated, maybe with M-Pesa services, to be able to use the mobile money SDK push functionality. They can also be able to bill an invoice for the patient, and we can also be able to process a bill so that now we can generate a receipt for our patient. So let us do that. So from the billing module, where our cashier is going to start, or is going to be the landing page for our cashier, they'll be able to access overview. Overview, what it does, it gives us a list of patients who have particular bills for a particular day. We can be able to access all patients who have either pending bills, who have had bills paid, or who have had their bills posted. And we can be able to do this as today's bill, cumulative bills for a particular day set to today. And we can also be able to view the same for a particular patient by searching for a particular patient. So when a cashier logs in, this is their view, whereby the system also offers the functionality of seeing the total cumulative bills over time in terms of the paid bills, again, disaggregated in terms of paid bills, pending bills, and exempted bills. And now they can be able to see what particular patients are waiting in their queue so that they can be able to process their bills and what is the exact status. So The system also assumes a first in, first out sort of queuing system here. So you'll find that the patient who has been billed last will come at the top of the queue. At times you may find in different facilities where we have so many patients being seen, and it is not easy for a particular cashier to be able to tell at what point this particular came, at what time were they even queued by the system. So it is always advisable to use the search functionality. So if we search for a patient, we are just interested in Paul Sharon, the system will just filter out for that particular patient. But if they're able to easily identify the patient at the top of the queue, depending on the time that particular bill was created, then they can still be able to access the patient here. Seeing the visit time, the identifier that gives that is unique to our patient or our client, Paul Sharon, and whatever items this particular patient is being billed for and the particular status. So we can be able to see that our patient is being billed for outpatient consultation, which has a pending status. So the link that the cashier will use is the name highlighted in blue is a link to be able now to access the payment processing window. Apologies for this. Allow me to refresh the system one more time. Let me just try to log in and out. So I'm experiencing a technological hitch with our test instance. I'm going to ask my colleagues on the call to confirm where the problem is. I hope nobody has touched the UAT test instance, either tried to refresh it or something. So as we wait for our test instance to refresh, let me try to access another test instance so that we can simulate the bill process payment section. So for example, in this particular test instance, we have two people or two clients who are waiting to be billed. Unfortunately, their status is paid. So let me try and see if we can create a bill for a patient from the dev instance, from another instance, so that we can we see whether it works. So trying to use this particular test patient, Mary Brown, we can check the mean quick fast again for outpatient services. They are not exempted from payment, and they're going to use mobile money to make payments. And we also want to bill them for, we can still use the same service, or just one of the ones that are here. Maybe a complete blood count, and we can check them in. So the system says it has successfully created a bill for the particular service that we have initiated for them. So going back to the billing module, our cashier will be able to see our patient from the overview, who is Mary Brown, waiting to be billed for a complete blood count charge. And once we access Mary Brown, the system will give us now an option or a window where we will be able now to process the payment. So the cashier will have access to the amount that is being charged, which is 150 for complete blood count. No amount has been rendered yet. That is why it is 00. The system will auto-generate an invoice number. So we have this invoice number 133 and the specific date and time that this particular bill was created, and the invoice status is pending. So at this particular point, the cashier can only be able to do several things. One of them is to print an invoice for our patient. And this is just to show our patient what you are supposed to pay for, the amount that you are charging you, and the particular status. So if it is a patient who needs to take this particular invoice somewhere for somebody to either meet this particular charge, the system provides the functionality of printing an invoice before the payment is processed. Then two, we have the functionality of M-Pesa payments, and this is where now we initiate the STK push by inputting a particular patient phone number. Let me use my phone number. So the bill amount is 150, and we can initiate patient. So if a health facility has been configured to be able to use the M-Pesa payment mode, that means we have a specific pay bill number whereby money will be reflected at the end of the day, and we have set all the configuration correctly. The alert here will change to STK push successfully. And once we input the patient number and the bill, the initiate payments button will be activated. And once we initiate, what the particular client or user will get on their phone is an alert asking them to input their M-Pesa PIN. And once they do that, showing the amount that they are being billed for, the system will automatically process that payment and will give another alert that shows that payment has been made successfully. So this particular process takes less than 30 seconds in a facility, and it's always advised if a facility has a particular pay bill number attached and we want to make cashless payments at the facility, we can be able to ask for configuration for STK push to happen. So this is one of the ways that the system is helping the facilities in making payments. So for us to be able to process this in a particular facility that has not yet been configured, under payments, we can be able to add a payment option depending now on what the patient will use. Again, we can still use mobile money even without configuration. The patient can decide to use to clear the bill, all the bill using mobile money, and we can get the particular M-Pesa reference number that has been used by the patient for that particular transaction. And when you do that, the total amount was 150, total that had been rendered will be 150, and the amount due will be 100. The system also supports partial payments in terms of a particular patient, for example, may tell you they have 100 bob within M-Pesa. They pay that and give you the reference number. And now the bill has been rendered for 100 and the amount due is 50 bob. So again, the system allows you to make different payments. Again, maybe this 50 bob, they can have it in cash. And once we do that, we'll find that we are able to process the payment. But now again, this depends on the scenario and the particular client that you're dealing with. So system allows you to do both. You can make a full payment, you can make partial payments, and you can also be used, it also allows you to use the different payment methods that a particular client can be able to use. In some scenarios, we may find there are several bill items. There are those items that will be paid by the insurance, and we can be able to check what exactly the insurance will pay, and we bill those ones for insurance. There are others the patient will ask or request to pay via mobile money. So this is why this functionality has been added in the system. So for this now, allow me to process the payment. And when you do that, and then let me refresh, we'll find that for the same patient now, looking through again at the dashboard, we'll find that our invoice status has now changed to paid because we have been able to process the full amount. And now we can be able to even print the receipt. The print functionality has been activated, and we can be able to print a receipt for our patient, showing the facility name, the date, the receipt number, the patient name and age, their specific patient ID, what we have billed exactly for, what payment methods we have been able to use. Here we have used both mobile money and cash, and a get well soon message. And this can be configured depending on a particular facility. And at the end of the receipt, we'll be able to see who has served our patient. The cashier name is what will be picked from the receipt. So that concludes one of the methods where we are able to process a bill. The other way that we can be able to create a bill in the system, one of the ways was at check-in, where at the time we are checking in a patient, we can be able to determine what particular service charges or commodity charges can we be able to make for our patient at that particular point. And we have been able to do that for outpatient services. So I'll still use the same patient so that we can go through the other modes of creating a bill in the system. There are three methods. One, at check-in, where we have checked in our patient when you're starting a visit. Then two, allow me to use a different patient here. Let me use this one. So I'm going to use this particular patient. Patient was checked. Just to still use our patients. So at the point where our patient goes to the clinician, maybe they have been seen for, they've had a consultation review, a clinical encounter has been filled and so on. And the clinician needs to order for specific orders, maybe a pharmacy order, a lab test, and so on. I don't know if we are still able to service this on this particular module. We need to switch our test instance to this one. So we can still use our patient from here. Fortunately, we'll not be able to go back to the other test instance. So using this particular patient who goes for clinical services, and a clinician has reviewed them and they feel there's a need to conduct investigative tests. For example, we can add an imaging test where we can have a leg X-ray for a patient. And just add this one, chest X-ray, and order that. Priority may be routine. Maybe save the order. Apologies for this. We may need to add a few chargeable items. We had switched test instances. So allow me to quickly add 2 or 3 chargeable items in this particular instance. So you have chest X-ray. Let's try and see whether it is turned on. Let's add mobile money. Let's also add for insurance. Let's add for 1 drug. And still use metronidazole. 400 milligrams. Mobile money, we can set it to 10 shillings. Can add for cash payment as well, 10 shillings. Insurance for 10 shillings. And we can save and close. So going back to our patients, Mary Brown, we may have a clinician now making an order for a drug. Still use the same drug, metronidazole. 400 milligrams, we make the order form. So the system is able to alert the clinician on the charges for this particular drug. For example, the charges here, as we had set them at 10 shillings, and advise the patient accordingly. And we can have the patient taking 1 drug as a tablet, orally, twice daily for 5 days. So that means the quantity to dispense is 1 times 2 times 5, 10 drugs, 10 tablets, so that they are taking 2 tablets for 5 days, once a day, and we can save the order. Indication can be, just pick anything. Save that particular order. So when we sign and close, the system has already placed an order for metronidazole. And when the patient now is directed to go to the pharmacy, and maybe at the pharmacy payments payment section or the billing the cashier at the pharmacy, they will be able to see that our patient has a bill for that particular drug. So when the patient comes to the cashier window, they will be able to see our patient, Mary Brown, and they have a pending bill for a chest X-ray and for particular drug. So when they select our patient for processing payment, now we have two particular section whereby they are just billing them for 250 for these particular items. One is service and another one is commodity. Now, in case our patient says they don't have money, they cannot be able to pay the full amount, 250, or they have partial, they can only be able to make partial payments. In some instances, we usually refer them to the social welfare office so that they can discuss whether that patient is eligible for a waiver, or if a patient even says they cannot be able to meet this particular amount, one, they can say they are not ready to make the payment today, they need to come at a particular day, or they are going back home to come and go get money and come and pay later, or they say they are not able to meet this particular cost. So there are several other functionalities the billing module offers, and these particular functionalities are now done by the administrative authority, either the finance manager, the hospital administrator, and so on. And we'll be able to see how we can be able to do that. So for us to be able to either now support partial payment or cancel even this particular bill for our patient, we'll be able to see how this can happen. But for now, allow me to assume the role of a finance manager who has this particular patient called Mary Brown has been sent to them because they cannot meet the full amount that is being charged, 250 for a chest X-ray and for this particular drug. And when that happens, the finance manager will access the bill manager section, search for our patient, who was Mary Brown. And once we do that, we'll be able to see that our patient has two bills for today. One, we were able to pay and process, which was the consultation for the complete blood count. And for this particular bill that was paid, at the manager level, maybe this particular payment was made erroneously. So what can happen here is that the system can allow the administrator or the finance manager to be able to refund the amount for a bill that has already been paid. So the refund functionality is available, but it can only happen for a bill that has been paid. So for example, our patient is requesting for a refund of 150. Maybe they were billed for the wrong item. They were supposed to be charged for consultation at 150, but at the point where the patient was being checked in, something else was checked and the patient paid. Now they have been sent to the finance manager to claim a refund for this amount so we can try and refund. So that means now this particular payment has been refunded successfully by the system. And for the other functionalities, so we can be able to see for that particular one, the system status now has changed to credited. But this patient also has two bills that are pending, one for chest X-ray and for metronidazole. And we can be able to either edit a particular item, for example, maybe for the drug. The edit functionality helps us to be able to edit the quantity. Maybe the patient was given 10 particular drugs by our clinician. Maybe erroneously, they were supposed to be given 20, and we can give a reason. Maybe at the time, the drug was out of stock. And you can save and close. Waiting for the system to refresh for the bill name, but we can see that now the quantity has changed as well as the price has changed. So whenever we try to edit a bill and change the quantity, it means now the price that will be reflected will be for that particular new quantity. At the same time, this particular bill may have been actually done erroneously, and at the level of the finance administrator, we can also be able to cancel that particular item. And the system will allow you that the current price is 10 shillings for 20. Maximum the particular quantity is 20 tablets, and give a reason for cancellation. Maybe you can say the drug is not available. The patient will need to go and buy from outside, so we can cancel that so that we eliminate the bill from the patient side. Then for the pending one that we have now for 150, either the finance manager can decide to either delete this particular bill if the patient is not willing to pay or they don't have money to pay, or they say that they will be able to get this particular service in another facility. They cannot afford the price here. At the same time, if you delete, the bill will just clear. At the same time, they can also be able to waive for this particular bill. And when we are waiving, the system allows us to waive for a particular amount. If the patient is able to meet the whole amount, we can waive for a portion of it. For example, we can waive 100 bob, so that means whatever balance is left, the patient will be able to meet that. Or we can decide to waive for the entire amount that is remaining of 200 and give a waiver reason. So maybe we can say patient was unable to pay, and the hospital has met the cost. And we can be able to post that particular waiver depending on the amount that we are waiving for our patient. So apologies for these particular functionalities in the system cannot be well demonstrated because of some of the hitches we have experienced with the test instance, but hoping when you're going to do this at the facility level, the package that is there will allow you to be able to do this. Then when now the patient goes to the various places where they are supposed to be given the services or even the drugs, for example, if a patient who has paid for a particular drug goes to the dispensing unit or the pharmacy, the pharmacist, upon searching for this particular client, when they go to them, they will be able to see whether our patient has been able to service for a particular drug item, and that particular section will be demonstrated here, the status of the payment, whether the payment has been effected or it has not been effected. Again, this will be determined if this particular charge item had already been activated for a price in the system. So again, let me try to refresh this because this is what should have given us the correct flow. And unfortunately, we are still experiencing a few errors there, but I'm hoping we have been able to actually follow through and be able to appreciate now the functionalities of the billing module within the system. Key points were that we can be able to make to define the different payment points. We can be able to define how our patients will be able to make payments. We can be able to define the items that our patients will be able to pay for and the exact prices. We can be able to, over time, be able to service some of the of the difficulties or some of the pain points within the billing system. We can be able to create waivers, we can be able to cancel a bill, we can be able to edit, and we can be able to even delete a bill within the same system. Over time, a particular finance manager will be able to access the payment history. Allow me to go back to this one. Some of the outputs they can be able to see from the system, so that by the end of the day, or for even a particular period of time, we can be able to tell by the different services that we're offering in our facility, what types of payment methods are being used across board, how many of our cashiers are there, and we can be able to use these particular filters to see different transaction history for our patients, what has been paid for, the exact service reference codes that have been used if our patients have been able to pay using M-Pesa, and the different status. And this will change depending on the filters that we have used here in terms of the date, either as particular start date and end date, a particular service type, a particular payment mode. For example, if I select mobile money, the filter, the output will change to only patients who have paid using mobile money. If, for example, I am using a filter for just a particular cashier, you can say Jennifer, it will just give me all the patients and all the payments transaction history that have been made for this particular cashier. Same happens with the service type, depending on the different service types that you have at the facility. We'll also be able to generate this summary as a download for further analysis. Then the same summary will be available for payment modes. For example, mobile money, what is the total that has been collected for mobile money, for cash payments, for insurance, for donations, depending again on how we have been able to set the different payment modes within our facility. So this is one of the sections where we'll be using for outputs, and it will be used by the administrative arm of the facility and the facility admin finance managers to be able to just see how payments are being made, have a control, an overview feel of the different service points and the different cashiers and the particular income that you're getting at the facility. Then as also part of the output, the system is able to give us specific financial reports. And for now, we will find that under MOH 717. When we generate that particular report, under the finance section, we'll be able to see total collections over time, amount that has been received, clients that have been waived, clients that we have exempted over time as part of the MOH 717 report. And again, this is also dependent on the particular time period that was used to generate a particular report. And this can be used from the report section. We can be able to put a particular time range. So again, if you want to see that particular report for a day, we can use the same day for a week, for a month, and so on, and we'll be able to generate that output. The other thing that we're offering the facilities as well is the functionality to view custom reports over time, especially concerning financial data, whereby for example, we have specific dashboards that are tailored from Superset, and they are available for each facility. Each particular facility personnel who needs to access this output will be given specific credentials and shown how to use them. And it's something that has already been cascaded at the facility. So what is available for the billing module, or the output for the billing module, is the financial data, whereby over time, depending on the time filter that has been applied, the particular facility that has been selected, and again, this will be just for one particular facility. If we're accessing information from one facility, we can be able to give an output in terms of the collections made by mode. Over time, we'll be able to see for insurance, the different insurance schemes we have, how much collections have been made for this particular time period, for this particular facility. If we've given waivers, how many have we given over time? Some of the payments coming in through cash, through mobile money, what is the specific amount over time? Then we can also be able to track the income that is coming through the particular facility for specific months. For example, we can be able to track for a period of 1 year or so. For example, here we can be able to see from May the various incomes generated for these particular facilities. For example, this particular test instance has 594 facilities. They have been able to generate this particular income over time. Then at the same time, we can be able to view collections for the last completed month by week. So that means for the last completed month, week 1, week 2, week 3, week 4, what are the different trends that we can be able to visualize for the financial data that we are collecting within the facilities. So with that, allow me to stop there. And what we can promise at this point is that we are going to share a better video showing the billing module functionalities in their totality. So back to you, Chair.
All right. Thank you. Thank you very much, Mary Ann, for the demo. Thank you, Otieno, for the introduction. So yeah, I think we can appreciate the reason as to why we really had to take you through this this module. It's quite loaded, and it's very key in as far as tracking issues around payments for the services that are billable or the services that are meant to be paid for by the recipients of care, in this case, clients who access services in all these in our facilities. So yeah, we are about 20 minutes to the top of the hour. I want to quickly just try to run through the chat to see whether there are any questions. I know Otieno, Moses, Lydia have been available to respond to most of the concerns that were raised as Mary Ann was doing the presentation. And I think some of the questions were around whether you are able to make payments from using two different sources. Like, for instance, can you do M-Pesa and probably insurance or cash? And I think Mary Ann has demonstrated how you can be able to apportion your payments based on what you have at hand or what is available in terms of okay, like if for instance you have insurance or you have SHIV or whichever other payment. So that is very possible. There was also another question that was raised earlier, whether currently you are able to, like, for instance, if you have a list of items that are billable, are you able to upload it from an Excel? Like, are you able to do bulk upload? And I think that feature is available, yes, but it's still work in progress. It's being tested. So in the next release, I think it's our hope that that feature should be enabled, because sometimes entering an item one by one, if you have a very long list, sometimes that can be very tedious and sometimes can be very discouraging, because that means you'll spend some time doing work that could have been done at a click of a button. So I think Otieno has already responded to that is work in progress, and hopefully that should be completed in the shortest time possible. Hopefully in the next release, and this probably would be the beginning of the year, we should be that should have been sorted. I think the other question was if you delete a particular payment mode, is previous data under the payment mode still retained? I think the answer was yes. That was already responded to. There was, I don't know whether this was I think it was. There was a question from Emmanuel. Please elaborate on how to configure money payment to go to certain. Yeah, I think this was already responded to. Moses responded to that. I don't know. This wasn't so clear, and then it seems like it has not been responded to. I don't know that this was responded to. There was a question from Alphonse, and Alphonse wanted to find out whether we can have one payment point with more than one description. So I really don't know what that would mean. I don't know that Otieno, you're able to understand that use case, or Moses. I've ran through it seems like that has not been responded. I don't know whether it was clear and maybe if Alphonse can verbalize that would be helpful. And then there was also another question from Joka, and I think this has also not been responded to. And Joka wanted to understand better what the attribute type mean. I don't know whether Marianne, you're able to respond to that in the process of your presentation, but if not, you can quickly respond to the rest. I think already responded to from the chat, but I guess I think in the process of your presentation, you're able to respond to again most of the concerns that were raised on the chat. So I think those are the few that I'm able to pick. Yeah, I think I can see another one from Abel Nyabuto. So Nyabuto is asking, in facilities that offer a given package of care, investigation, and some drugs for free to CCC clans, and have other services that are payable, is the system able to configure to accommodate this, or the services have to be waived whenever a CCC client have to get services? All right. Yeah, thanks, Moses. I think, Moses, you've already responded to that particular concern. So, Marianne, I don't know whether you can make a comment on those two. If you may have responded to in the process of your presentation, but probably maybe you can just highlight the attribute. I don't know whether you got what Peter was asking, and then the other one was whether we can have one payment point with more than one description. So any comment on that, Marianne? As meanwhile, I look out for any ads. If you have a question, you can also raise your hand. We can allow you, we'll give you an opportunity to just ask your question. But Marianne, meanwhile, you can comment on those two.
Yes, thank you, Songok. I was avoiding the attribute type because it is still work in progress. But this is some of the configurations you can be able to make for a particular payment method. For example, there are facilities that have specific outreaches, and particular payments for particular clients are made by a particular organization. We can take, for example, a Smile Train that conduct outreaches in a particular time in a month. So you can be able to set when that happens for this particular payment mode in terms of the duration, the time, the expected number of clients that will be able to see and activate it even for a particular period of time. So again, for the attribute section, it is still work in progress, and it will be made clear in the next versions also. I'm not sure if I remember the other question that was pending.
Yeah, so the other question was whether we can have one payment point with more than one description.
One payment point, for example, maybe a payment at the pharmacy that can be able to bill for not just pharmaceutical services, but all the other services.
I guess that was the use case. I'm not certain, or maybe Alphonse can verbalize it so that we can have some more context on the same.
Yes, yes. As much as we are defining specific service payment points within a facility, it doesn't mean that you can only bill for that particular service offered there. If the workflow within the facility allows, a patient can go to the lab and be billed for other services, not just lab services, that is still fine. But if a particular cash point is specific for a particular service, at the pharmacy, they can only be billed for pharmaceutical commodities. At the lab, they can only be billed for lab services, at radiology and so on. Then it depends on the workflow in a facility. But I'm not sure if I'm answering the right question, because the question is not very clear.
All right, thanks. I think you have tried to respond, because I'm also not quite clear on that. Yeah, so I think those are the ones that had not been probably adequately responded to. So there's one from Cisco here. Maybe we can take this and then we close, because I can see it's 10 minutes to the top of the hour. Can we get summaries for each insurance scheme? That is, I think, from the dashboard, the custom dashboards, you are able to show the collections or the payments, and I think what Cisco is asking is that, are you able to just disaggregate further into, let's say, for instance, what payments were made through insurance. Like in this case, I think they proposed our own or any other insurance. I don't know whether that is possible, because these are custom. So I think you can always, because the source is already known. I believe this is something that is possible, and probably even the facility can be able to do this. Then there's one from BKK. One checks in with an exemption on billing, but throughout the visit, you realize she needs a service that is billable. Can one switch, or all will be waived? So I think this has already been mentioned by Mary Ann, that billing is not only done at the clinician's desk, it can also be done at any other service point. So at the point that you discover or you realize that there was a payment that needed to be, there was a service that needed to be billed, then I think you can also be able to do the appropriate thing. And maybe Mary Ann, you could comment on that as we close.
Yes, for the question on whether we will be able to generate summaries for the different insurance schemes, this is work in progress. This is something that is being incorporated so that we can have for each payment mode, what are the particular schemes contributing to insurance payments, and we'll be able to tell for each and make the reports downloadable even from the UI itself. So this is work in progress, and it will be availed in the system.
Okay. All right. So yeah. So thank you very much, Mary Ann, for your responses. I'm not seeing any hand up. Just give me a minute. Yes, I'm not seeing any hand up. So I think I want to take this opportunity to appreciate each and every one of us for attending this meeting. I don't know, Otieno, I don't know that Ajwang is in the call. I wanted to allow him to just make a comment before we close. Yeah, I think Ajwang, you're in the call. So Ajwang, if you can hear me, I want to allow you to just make a comment on behalf of the team here before we close. Bernard, Ajwang. All right, so maybe Ajwang akitafuta mic. Otieno, maybe any parting shots before we close?
Yeah, thank you. Thank you, Songo. Yeah, I think I just want to say that one, we really appreciate your time and your patience for the last almost 2 hours. We are encouraging more attendance in the future training so that these trainings can reach as many people as possible. It is important that also we get feedback in terms of some of the areas that you feel you need to conduct refresher training on. So for this year, this is our second last training. On Thursday, we are going to have a training on the MCH module, again, which also has come up as a result of some of the feedback that we received and the areas that we need to prioritize. So in collaboration with the NASCOP, we always put out these trainings, and we believe that next year we'll put out more so that as the days go by, we'll get as many people as possible to be comfortable and confident in navigating the facility-wide KenyaEMR. We appreciate that it is a new kind of frontier for everyone, because I know the majority have always been very confident in getting the HIV version of KenyaEMR. So going into the entire facility present different new sets of challenges and issues, but I think we can work together with everyone to ensure that as we move forward, we get the feedback, we improve on the system, and we give you the features that you want the system to have. So up to that point, I just want to say thank you, everyone, and back to you, Sombo.
Right. Thank you. Thank you very much, Otieno. And I think as a NASCOP team, we appreciate the collaboration between NASCOP and Palladium to just make this possible. We always strive to build the capacity of all the service providers, and we always strive to build the capacity of the service providers so that we can ensure that all of us are competent in ensuring that we utilize all the modules that have been developed for client management, and of course, more importantly, for just accounting for the workload that we've been able to provide in our facilities. So thank you very much. I want to wish you a blessed evening. I don't want to say happy Merry Christmas and Happy New Year because we still have another last virtual training on Thursday before we close the year. I think Otieno has already mentioned it. So we'll be taking you through the MNCH module. So we urge you to planned to attend, and that would be the last one for the year, and then we can again just slot in some more for the coming year. So up to that point, asanteni sana. I want to request again Moses Care to close for us with a word of prayer. Moses, pray for us, and I think after that we'll close from my end. Thank you very much. Namubarikiwe sana. Thank you. Moses, take it away.
Songoka, see, I'm becoming the resident bishop for these trainings. So, Father, again, we thank you for having brought us safely to the end of this training. Lord, we thank the facilitator, for the wonderful presentation she has made. We pray that all that we've learned today may it stick in our heads, and that may we go out there and utilize in our service. We pray this short prayer, trusting in your Son Jesus' name. Amen.
Amen. Thank you and bye.